check sent straight to seniors. That's the basic breakdown of the government's latest COVID-19 relief program. $2.5 billion will be spent to send money to seniors. Those eligible for old age security will get $300, and seniors eligible for the guaranteed income supplement, the GIS, will get an added $200 for a total of $500. But will a one-time payment be enough to support one of Canada's most vulnerable populations? And why just for a month? Let's find out. Seniors Minister Deb Schulte joins us now from Ottawa for some answers. Minister, good to have you back on the program. Hope you and your family are well. Can you tell us why this program, it's $2.5 billion, so it's a big program. Why will it only go for a month when the Prime Minister says the pandemic will last much longer?
So, Evan, it's a program that is built on what we've already done for seniors, and it's the intent was the fastest way to get the money in the hands of seniors that are dealing with additional costs as a result of the COVID-19 pandemic, and so that's the reason why we've come forward with the program as it is.
Okay, but again, I'm just trying to get at how you're spending. It's a lot of money. But why just a month? If the pandemic goes for 6 months, and that was the figure the Prime Minister said today in his press conference, what if seniors say next month, hey, we're still short, we're facing the same situation in June as we are in May?
So the way to look at it, it's not about a month. It's not about a time schedule. It's about a way to get a significant amount of money in the hands of Canadian seniors that are needing it as a result of additional costs that they're facing with the pandemic. So I just want to build a little bit on what we already have provided. 4 million seniors in April received, on average for single seniors, about $375, and on average for couples, they received over $500 in their accounts in April. So this is for low and modest income seniors, 4 million. Now we're moving to an additional benefit that is going to 6.7 million seniors on old age security and 2.2 million seniors that are on guaranteed income supplement. So for those that are on guaranteed income supplement, they get the $200 payment, and if they're if you're on OAS, and the GIS will already also be receiving the OAS, so they will have $500 in their bank accounts, and those are on old age security will have $300, and if you're a couple, you'll be doubling those numbers. So if you look at that on guaranteed income supplement, a couple on guaranteed income supplement will receive over have received from our government $1,500. That's a lot of money.
Let me just flip it around. Yeah, no, it is a lot of money. So let me just flip it on the other side, Mister. Seniors are already getting a break on GST. Your government gave that. The OAS and the GIS remain if they qualify for that. Why do seniors need more money? Why do they need a one-time payment if those programs have not been affected?
So you're absolutely right. They're still getting their benefits. So why are we considering seniors needing help? Well, they do need help, because they are the most vulnerable. They are the most isolated. They are told to keep into their homes, do not go out, do not expose yourself. So they are needing extra help to be able to do that. Some provinces have put in place minimizing the amount of medication that they can get at any one time. That's multiplying the cost of dispensing fees, and some of those, it's 3 times the cost of what they would normally be paying. The food prices, some of those food prices have gone up. Delivery, they're having to pay delivery costs that are going up. They may have used to take public transit. Now they can't. Maybe if they have to go to an appointment, they're taking a taxi. That's a much higher cost. I'm hearing from those in rural communities, their local shop is closed. They're having to go to multiple communities to try and get the supplies that they need because their local shops are closed. I mean, this is additional costs that they need to
Minister, I appreciate that. So this is why senior advocates, and I spoke to some of them today, are calling for, look, if you're only going to make this a one-time payment, what about other things? I'll give you some examples. Tax deferrals or a pause on penalties incurred for that occur when you access, let's say, your RRSP or your RIF funds. So, for example, the mandatory withdrawal of a RIF at 71. I know your government has already lowered the threshold of that. I appreciate that, but it's still taxable. Some are saying make that tax-free. That allows seniors to keep that in their pocket. Would you do that?
So, Evan, there's a tremendous number of great suggestions that have been coming in from seniors and advocate groups. And so we're looking at all of those. And as we progress through this pandemic and see the way the economy responds, we will be looking at all of those to see, what else may need to be done.
Okay, let's talk about long-term care homes where over 80% of the deaths have occurred. I recognize this is provincial responsibility, but there are options for the federal government. 1,800 people have died alone in Ontario. First of all, you could have an independent public inquiry. We've done it for much different situations where there's far fewer people who have died. Will your government commit now, given the horrific number of deaths, to a national inquiry that's independent and transparent?
Evan, the stories that we're hearing out of long-term care homes is devastating, and there's no question that it is revealing cracks in the services and opportunities for improvement. We have been taking a Team Canada approach. You and I had this conversation before. We've been working very closely with the provinces and territories because what's important right now is that we deal with the crisis, that we're working on solving the problems. There will be time, and we will be working with the provinces and territories in the future to making a more lasting solution and solving these problems. But right now, our focus has been on the ground. We've got the military going in to 25 homes supporting there. We've got wage subsidies to support workers and try to get more people to come back into that profession and come into the profession so that we can get the resources that are needed there.
But Minister, and I appreciate all that, but you can do, with all respectful, you can do two things at once. There are options. The military is only going to be there for a month, according to the Minister of Defense, because they have other responsibilities. Today's announcement is also only a month. So one, many are calling for an independent national inquiry. Two, some are saying, though this is provincial jurisdiction, you should pull this into the Canada Health Act so there's federal guidelines that are enforceable. Or three, Jagmeet Singh told me on CTV's question period on the weekend that the federal government should ban privately owned long-term care facilities where the majority of the deaths have occurred. Are any of those three options on the table?
So I first just want to address, there are many good long-term care facilities. My mother-in-law is in one, and my father-in-law is in a seniors residence. And, while we are very anxious for them and their safety, we are really happy with the work that's going on in those facilities to keep them safe. And so I think it's really not appropriate to be classifying particular classes of facilities and saying that they are no good. That is not right. There are definitely issues around long-term care across Canada, and it is not the same in every province. So this is not a knee-jerk reaction on what we need to do. I think we need to solve the issues that are that we're dealing with right now to keep people safe, right, keep our seniors safe, save lives. And there will be time for us to work with the provinces and territories to find those lasting long-term solutions. And how we do that, that is to come. Right now, we're focused on the immediate needs of serving seniors.
All right. Well, the tragedy is seniors are dying, and I know that is the tragic reality we're all living with right now. Minister, I always appreciate you joining us. Thank you so much.
Thank you very much, Evan. Have a good night.